Welcome! Here's your bubbly and beautiful host, Elizabeth. It's the Caffeinated Cooper Show.
Yeah, I believe in you. I don't believe in lucky sevens. I'm not sure about my nest, but I know I believe in angels. I believe in happiness.
Good evening, everybody. It is wonderful to have you with us. I am so happy to be broadcasting again. I love this show. You know, doing something that you love is barely even like a job, right? Not even. So, did you catch that? Was that a little bit of who's watching? Guess what I forgot to do? Share the intro screen before we started. But I'm glad that you're here with us. Make sure that you like and comment. You like over there at YouTube. YouTube has been a little particular, so we're not live there tonight, but the shows are all going to be moved over there very soon. So watch out for them. I'd like to talk about our sponsor first this evening, and it is Kogo Coco. I love telling the story about Kogo Coco because it is U.S. Army military designed, and here's the story behind it. So if you go to their website, Kogo Coco, that's COGOCOCOA.com, it'll tell you about the story. And basically, they have MREs, which is going to be ready to eat meals when you're out in the field. And they had a mint in the meal. So when you're done with the meal, you have a mint. You know, so many people do that, right? Well, the mint had a full cup of coffee's worth of caffeine in it. And of course, that was for the purpose of keeping you alert and awake, right? Well, one of the military members and the gentleman that I spoke to would not release his name, and we were on an encrypted phone call when we did the interview. He said, you know what? I wanted something that felt like home. I wanted a cup of cocoa. And this is Kogo Coco. It is available on the website and on Amazon. And if you go to the website, there is free shipping, I believe. It's soy-free, which I love. I try to stay away from soy as much as possible because I don't need that added into, like, what, all of our foods? No, thank you. So it does have 98 milligrams of caffeine, which is equivalent to, let's say, 1 cup of coffee on average. And it's U.S. Armed Forces designed and developed. So go over to kogococo.com and get your refreshing cup of cocoa. We all need it. It's January. It's just a misty, it might as well be icing kind of day today. And that really picked me up today. All right, everybody. So we have a wonderful doctor connected with us, and we're going to be talking about fertility, what to do to set yourself up for the very best in your pregnancy, in even before that of conceiving, and men's health, the things to watch out for, the things to possibly do, alter in your diet and your lifestyle to be able to conceive a healthy child. So Dr. Peter Scire is known as the Brain Doctor. He is the Executive Director of Brain Balance Achievement Centers in Atlanta, and I believe that was a little bit in his past. So right now, he is, it is drscire.com. You can find out all about him. But he received his DC degree from Life University in Atlanta and has completed graduate studies in clinical neurology, nutrition, and vestibular rehabilitation at the Carrick Institute of Graduate Studies. He is a board-eligible chiropractic neurologist, which is really interesting. I've never had a conversation with a chiropractic neurologist, and there are so many different things about life and wellness that he knows, and he's going to guide us through. Let's welcome Dr. Peter Scire. How are you?
I'm doing great. How are you?
I'm doing fantastic. Thank you so much for carving out some time in a very busy evening to spend with us to talk about fertility. So you were on the show before, you're a friend of the show, and we had a great conversation. We talked about so many different topics, especially about autoimmune. And, you had mentioned that you have so many great tips and lifestyle tips, again, is the only word that's coming to my mind, to set yourself up for the very best in fertility.
Yeah, I mean, the big thing right now we're seeing is just such an increase in rise of autoimmune disorders in both men and women. And And when you look at, especially for people that are 35 and younger, we're being exposed to more environmental chemicals than we've ever been. Many of us are not keeping up with our antioxidant loads, like getting, if we're not eating a lot of vegetables and not eating a lot of antioxidant-based foods like blueberries and strawberries, we can't balance that relationship of inflammation to antioxidants. So really what we refer to as oxidative stress. And so it's this oxidative stress is this real fancy word for basically almost like you're saying that your body's almost kind of like rusting from within, where we make all these chemicals and we have these biochemical reactions in our body. And some of them they put off what we call free radicals. And when we have too many free radicals, we can damage our tissues and we can damage our organs and can create a lot of systemic inflammation. So one of the hallmarks of what we're finding out in the infertility world is the amount of inflammation that many of both women and men are having in their day-to-day life, that's actually preventing the way their brain is communicating to their end organs, whether it's in a woman, how the brain is communicating through the pituitary gland. We have this central gland in our brain that releases our releasing hormones, and it talks to our end organs like our ovaries in women, or thyroid in women, or let's say in men, their testes. And when you have a lot of inflammation in the body, you can actually disrupt the communication of that network. And from there, you can also develop a lot of different components of, you get a lot of what we call adipose. You can get what we call these adipokines. And adipokines are these inflammatory markers that in the tissues of basically your fat tissues that can continue to create this inflammatory loop. So one of the simple things that really comes down to is understanding how to control inflammation in your lifestyle.
That sounds so easy. We hear about controlling inflammation, the anti-inflammatory diet, or there's so many different things that we hear on a day-to-day basis, from the news stream to articles. Are you able to, pinpoint or simplify that a little bit? Because what's the right thing? What's not the right thing?
Sure. Well, for one, with the generality is that you have what we call an autoimmune paleo diet. Okay. And what that really does is you begin to reduce the big inflammatory foods. There's been a lot of great labs. Some of the mentors I've had in my clinical career, Datis Karazian, who is this phenomenal clinician on the West Coast. He's written textbooks. He has actually a Karazi Institute education arm that I've been a part of for many years now. Has written extensively and published research papers on the interaction between foods and your immune system. Okay, so for example, many grains, especially in the gluten family or grain family, can eventually create an immune response that will trigger destruction of tissue. Okay, for example, if we eat an abundance of gluten and we keep eating it over and over, because gluten has been number one, we have glycophosphates on a lot of our foods that can cause chemical changes to the food, because of the way the food has been manufactured and basically hybridized over time to resist being killed off by bugs. This has changed the way the proteins work in the foods. And so what we're really talking about in many foods is their protein structure. And when you have these certain protein structures and we can't break them down, we can't completely digest them, our immune system thinks of them as a pathogen. And then we make an antibody to this food, whether it's a milk protein or grain protein, or even certain vegetables like nightshades, like tomatoes and mushrooms, even lectins, foods that have seeds in it. We can create these immune responses and make antibodies, and then our T cells come about and will actually destroy this pathogen. But the problem with that is that once we made the antibody to that protein sequence on, let's say, dairy could be found on our tissue in our thyroid gland. And now it's like these little Pac-Mans that are coming to the thyroid gland and destroying the thyroid. And when it does, you get autoimmune thyroid. So, for example, there's a lot of women that are walking around trying to get pregnant, and they have not even been we had a full thyroid workup. Traditional thyroid workup might just be the TSH levels and the T3 or T4 level, and no one's thought to actually look at auto antibodies. Okay, so you have these different thyroid antibodies, like TPO antibody, that can be measured, and if it's elevated and your TSH level is elevated, then you could potentially be diagnosed with autoimmune thyroid. So that's something right there. There's a really big thing for women, or let's say the women that are in their, let's say their mid-teenage years, they've begun to have their menstrual cycle, but they have these really abnormal menstrual cycles. Eventually, they can develop what we call PCOS, polycystic ovarian syndrome. Okay, and that's really driven by an inflammatory loop in the body. So, and if that goes undiagnosed or mismanaged over time, it can begin leading to another potential autoimmunity. And one of the most common autoimmunities in women is thyroid.
Very interesting. So autoimmune thyroid, how are you going to feel? Are there any symptoms that people could say, oh, you know what, maybe I should get my TSH levels and T3, T4 checked?
Yeah, I mean, there's basically two types of thyroid issues that happen a lot of times, where you can have what we call hypothyroid symptoms, where it's more of a kind of like a fatigue component of it, kind of like I'm just constantly tired. Also, you can have what we call hyperthyroid, where now all of a sudden I get a lot more heart palpitations, everything, I get a level of anxiety. Okay. So you can go like where you have hypothyroid symptoms or hyperthyroid symptoms. That's generally, sometimes in more advanced cases, you may see like changes in hair. Some of the women may lose some hair, or they may lose out of 1/3 of their eyebrows. They may see some changes in temperature, during the day or at night, mostly at night. A lot of times you'll see maybe some excessive sweating. So these are some signs. In more advanced cases of thyroid, they may get some thyroid swelling of their thyroid gland, or they may just feel like almost even some pain. Sometimes in really advanced cases of thyroid problems, you may begin to see a formation of a goiter, or they may start palpating around their thyroid and notice maybe some nodules. And those are typically more advanced aspects of it. But basically, with the thyroid, it's probably going to be more these, like, I'm sluggish if I'm in hypothyroid state, and if I'm in hyperthyroid state, I may have this really more like fast intensity of my basal metabolics, and I might notice that my heart rate might be up, or my pulse rate might be up, or I'm just this like on edge and really anxious, go. So those are kind of the symptoms that you may see with the thyroid. And I'm seeing it in younger and younger women as I work with. In my practice now, as you mentioned, early in my career, for the first 10 years of my career, I had my brain balance centers. I still have them, but I'm not actively involved in the day-to-day operation of that, because I actually maintain a full-time private practice. Now, what's interesting out of that is that the majority of the women that I actually work with are some of my former brain balance moms that I worked with years ago with their kids with developmental disorders, that are all now in their 40s and 50s, that are having chronic fatigue syndrome, thyroid problems. They're having migraines, and no one seems to be able to get to the root problem of this. So.
Interesting. So something that you had mentioned, the nodule on a thyroid.
Mm-hmm.
So I would say, let's see, how old is he? 12 years ago, I was pregnant with my 5th child. And
Mm-hmm.
I think it was some x-ray of my spine or something showed that there was a nodule on the thyroid. No one ever said anything about checking TSH levels, T3, T4, nothing like that. Nobody said anything about full blood work. I just went to an endocrinologist. They took care of it. And it's like, okay, there you go, sweetie, you're done. I'm sure there are so many thousands of people that have experienced that. What was the right way to go about that? And I mean, obviously it didn't affect my fertility. I was pregnant with my 5th, but what was the right way to go about that? Just for anybody that's experienced it, since we're talking about the thyroid.
Yeah, I think it really starts by just being an advocate. Obviously, there's some really great books out there. I mentioned my colleague, Datis Karazi, and he's probably one of the foremost authors in the world on thyroid. And he has a really good book out there about the thyroid. But there's a lot of other people that have other functional medicine practitioners that have written about the thyroid. But if all you're doing is getting on your standard wellness checkup, you're only getting your TSH your T3 or your T4 measured, women really need to, and men as well, because I've found thyroid. Again, I can, there's a couple times I've had men where they've thought that they were having, low testosterone levels, and then we ran their testosterone levels came back normal. But when we ran their thyroid hormones, their TSH came back not in the sweet spot, and then they had elevated thyroid antibodies. So now they have maybe autoimmune thyroid, and that in itself could give a presentation of low libido or problems with maintaining an erection. It's not just purely low testosterone. Okay, so in both male and women's, it's very important that when you get a full workup, you need to not only look at your TSH, T3, T4, and when we say T4 or total T4, that's the bound protein portion of the thyroid hormone. There's actually this thing called free T3 or free T4. And then you need to look at your reverse T3. Reverse T3 is a great way to look at how stress response of the body, cortisol, is actually impacting the ability of the thyroid to utilize or how the thyroid is converting those thyroid hormones to be used. Okay. And then you run your thyroid antibodies, because generally what happens when you have thyroid antibodies presence, meaning that there is some type of, whether it's a food, a chemical, a virus, that's potentially driving an autoimmune response to that tissue. Okay, and the reality of it is that when there's a thyroid antibody that's present, 90% of the time you can actually develop thyroid antibodies to your brain. Okay, you can, and Dr. Karazian and Dr. Risto Rajani have written paper after paper on this over the last decade, showing that you basically, once you find one autoantibody to a tissue, the odds are you're probably going to find probably another 2 or 3 autoantibodies to other tissues. You're just not searching for them. And this is where the patient that once had thyroid problems now, maybe 5 years later, develops osteoarthritis or develops rheumatoid arthritis or now develops vasculitis, okay, or maybe eventually develops MS, or now you're seeing more awareness to even ALS. I mean, these are all under the banner of autoimmunity. Okay, so you're really getting in there and saying, okay, on a very routine lab, because it could be a routine lab. It doesn't take much to ask your primary care provider, hey, will you throw on thyroid antibodies, TPO antibodies, and thyroid globulin antibodies onto my routine thyroid test to see, and if those come back positive, then you can go down and try to have some more autoantibodies run to see if you're reacting to other potential tissues.
That's great advice. I want to back up just a moment to where you were talking about low testosterone, that it may not be low testosterone. It could be your thyroid. So what if someone feels that they have low testosterone? Obviously, they're going to, check their testosterone level. Is it possible to have a low testosterone level and a thyroid issue?
Yeah, because when you get into like looking at, let's say, end organ, so let's step back for a moment and just talk about how the endocrinology is kind of set up. So first we got to look at our nervous system talking to our endocrine hormone glands. Okay, so let's say for instance, the man. Okay, so we have that pituitary gland that we were talking about, and then we have these releasing hormones called LH and FSH, and they have a very specific function on reproductive organs in both men and women. And so right off the bat, you first want to look at that. Okay, look at the connection to LH and FSH. And if we were looking and talking specifically about the thyroid, we were talking about TSH. Okay, so these are releasing hormones that are coming out of the pituitary gland and going to act on the end organs. And so right off the bat, you're always looking at that, because you want to see first is maybe the lack of testosterone there because the fact that the brain is not talking to the end organ. And is the brain not talking to the end organ because I may have some type of neuroinflammatory mechanism going on? Okay, I may have, let's say this patient that walks in and says, okay, well, I'm suspecting I have some low T, man that can't get erection, doesn't have a libido, but is he pre-diabetic? Does he have metabolic syndrome? Okay, and if you have a metabolic syndrome or pre-diabetic, you're creating this inflammatory loop that's then going to change the way the higher centers of the brain are talking to the pituitary gland. It's going to change the way the pituitary gland is then talking to the hormone, to the end organ gland, and that might be the reason why you have low T. Okay, and here we are going to go and just put extra testosterone in this patient, but yet they meet all the factors for metabolic syndrome.
Wow. So what's the end result? If, this gentleman is going in for testosterone shots, but, he's also pre-diabetic, he also has all these other issues. What happens when they're just masking it with testosterone?
Well, I mean, you're going to elevate testosterone, obviously, right? Because you're
Right.
injecting the testosterone, into the body. But at some point, there may be a receptor sensitivity to it, where the receptors are going to not respond to it, and really because of the fact that there's this underlying inflammatory loop that's happening. Okay, I can tell you this. I mean, there's actually this thing called andropause in men. Okay, and andropause in men is when men are taking their testosterone and aromatizing it, and that means they're making too much estrogen. Okay, and that's the main reason why they're actually or they're not able to make their testosterone, because they're actually aromatizing. Okay, so and there's this real critical hormone that's there that doesn't get a lot of press. It's called DHEA. Okay, and DHEA is a hormone. It's a kind of a rate limiting hormone. It comes off and where all our hormones really come from is cholesterol. Okay, so now let's think about that in the context of traditional healthcare in this country. How many people you think are on a statin, okay, that are now lowering their cholesterol, or they've been told to like eat this really low fat diet, because fat diets are going to drive up cholesterol levels, okay? So now you get these people that are either on a statin or they're doing low fat diets, okay? Cholesterol goes down, goes into DHEA. DHEA now is going to convert to all your androgens, so all your estrogens, but it's also then going to convert to testosterone. So a lot of times what we'll do in our office is that we'll actually measure DHEA in serum or in a salivary test, or you can also use these really cool tests that are out there for urinary testing as well that allows to do it. But if you really start out with serum, you can get a good look at this. So these are other mechanisms that are in play. Okay, is that especially a lot of my 45 and older men. I get into my 50-year-old men that are coming in and go like, hey man, I can't get an erection. And the first question I ask them, you're on a statin medication? They're like, yeah, I'm on a statin. I've been on a statin for 10 years. All right.
Interesting.
That might be a simple answer right there, man. How do we change your metabolic state so that way you could potentially come off your statin? Okay, because that might be the main reason why you're not able to affect your impact your testosterone levels.
Very interesting. I have a question here from Ken. He's saying, would actually not having sex for a long period of time effectively potentially give a man health issues?
I mean, that's an interesting question. I'd have to think through some of the feedback loops on that. Okay, but I mean, I think that what is it are they choosing not to have it, or is it the fact that obviously that the mechanisms of it can't happen? Okay, when you get into sex, obviously there's a couple things that are happening. Number one, the primitive part of the brain that is really your midbrain, your primitive urges is we have these hedonistic centers of our brain, okay, and they're really dopaminergically driven. Because if you think of it on an evolutionary level, basically we've been designed to basically eat and propagate, okay, and so the idea that we want to have sex is a very brain-based mechanism, okay. So, and there might be some things there from a standpoint of lack of frontal lobe to midbrain mechanisms that cause the act of not enough dopaminergic activity that drives the need to want to have sex, and then also bring the sense of arousal to the brain levels at that level. But then you can also then start talking about brain to endocrine functions that may also be impaired, and then that develops a psychological component that's there as well. Now all of a sudden that a man goes, okay, well, my stuff won't work, so why have sex? Okay, or so there's a multiple of mechanisms that are happening there that I would say that need to probably be looked at. Okay, I'd look at all the physiological mechanisms that might be in place first, and then begin to unravel the dynamics of the psychological component to it, as well as the neurological aspect of it. Okay, I mean, is there any history of any trauma, any types of past trauma in relationships that create that aspect there?
So I'm going to ask what I think is a really dumb girl question, because I'm a girl, I'm not a guy.
Okay.
In the realm of that question, so the body is going to produce sperm.
Mm-hmm.
Okay. If you don't, either have sex or masturbate, how does the body does it reabsorb? Like, what happens when you're constantly producing sperm, right?
Yeah, I mean, I'd have to think about that one. I'm not 100% sure on that one. That's a question I've never been asked, so I might have to get back to you on that and kind of begin to explore that one relative to what happens to if men are not ejaculating, what happens to that. But I would imagine that it comes back down to feedback loops. Okay. I mean, at the end of the day, there's an element of all these feedback loops in the body. Okay, so if for some odd reason that the man has chose not, and there is a lot of literature about both for men and women the healthiness of ejaculation. Okay, the idea that when we do have some level of when we are ejaculating and we're having some level of orgasm, you are producing opioids in the brain, okay, and you are producing these opioids systemically within the body, okay, that to create a more of a happiness. And opioids are also very related to just an anti-inflammatory effect, okay. So anything that can bring you more happiness, you're going to create an opioid relationship to that. So
you're saying have a lot of sex, and that's anti-inflammatory?
There's definitely, I would say that's a lot of a big thing for an anti-inflammatory aspect, diet, of lifestyle. Okay.
Okay. That's interesting. Never heard that before, but it makes total sense, right? Wow.
Yeah. Yeah. I mean, that's the thing about the human body, man. There's all these great things that we can do to support our anti-inflammatory, components of our lifestyle. And that would be one of them. I mean, joy. I mean, anything that brings you joy is going to give you a more opioid-based aspect. And I mean, because you think about that, what's been the big controversy over the last 5 to 10 years in the drug, the pharmaceutical industry is what? Opioid addiction, right?
Oh, sure, yeah.
So the idea that can we generate opioids, and opioids are pain inhibitors. Okay, so definitely do things that are joyous, and obviously you get into the component of, even if it's not let's say sex, it's just the fact that you're with somebody that makes you happy, and somebody that even if you're hugging them and you're holding them and you're doing things together. I mean, that in itself is going to also drive opioid production in the brain and bring overall well-being to the body.
Very interesting. Wow. Okay, so that completely derailed me. But we're talking about fertility and how to set yourself up for the very, very best chances of conceiving a healthy baby. So going back to the female.
So that would start out first is trying to really do an inflammatory inventory. Okay, we know that like BMI is a real big thing, body mass index. The greater your BMI, the more likely you are to have difficulty with getting pregnant or even sustaining the pregnancy, or if not after the pregnancy, postnatally, the amount of inflammatory markers and systemic inflammation that the mom may also alter the way the brain is going to develop in the womb, develop in the first year or two, and that could lead to potential developmental disorders. So that's number one and even the opposite of elevated BMI, we also know that women that have low BMIs also can have a great degree of risk for complications or trying to get pregnant as well as sustain the pregnancy. Okay, so there's actually literature that actually supports a normal BMI level. Okay, so and that goes for both men and women. Okay, number two, if you when we were younger, probably like the big thing was like smoking cigarettes and drinking alcohol. Okay. Mm-hmm. We obviously know, back in years ago, you would, old advertisement of cigarettes, you'd actually see, ads with doctors, saying, hey, it's okay to smoke during your pregnancy or whatever. Right. Well, we know that's not the case. We know drinking alcohol is not the case. Okay. But the bigger thing now is all these kids that are vaping, right? Ton of literature out there on the amount of chemicals that are in these different vaping devices, okay, that are going to not be able to be cleared by the body. Okay, the body has a certain capacity to clear chemicals through our antioxidant cascade, which are like our vitamin E and vitamin C and vitamin and beta carotene, and the big player of antioxidants is glutathione. But we can't we our body can't keep up with the amount of different chemicals that are out there. So there's this thing called endocrine disrupting chemicals. So EDCs, and there's a variety of them, and they're coming in, throughout, everything that we in basically our cleaning supplies in our house, our personal hygiene products that we all use, flame retardants that are on everything, all the flame retardants that are on your clothes, the flame retardants that are on your beds, the flame retardants that are in your carpets. I mean, just totally. I mean, if you want to, they also call these endocrine disrupting chemicals obesogens. Okay, they're driving the expression of obesity, and so that's where you got to start going. Is you got to start going down the rabbit hole and say, how am I inflamed? And one of the easiest ways to say, how am I inflamed? Number one, do my joints hurt? Do my muscles hurt? Am I, constantly having brain fog where I eat something and 20 minutes later I can't, I'm having difficulty concentrating or difficulty remembering things, or I go to speak and have loss of words. So these are all signs of inflammation. You also have the Instagram crowd group of people that want to be every influencer, and they want to have the hot body, and they want to have men and women, but yet they're overtraining because now they're like spending 5-6 hours in the gym, and all they do is overtrain. So now they're just going to make an abundance of your IL-6 that's going to cause all kinds of inflammatory aspects. So just because you look good in a bathing suit or a bikini doesn't mean that you're healthy. I mean, you could be totally wrecking your system. And that's why we're seeing this whole thing now with all these kids, these young, 20, 30-year-olds that seem to be fit, but yet they reacted really bad to catching COVID, or some of them, or really getting sick and developing all the immune disorders early on in their 20s and 30s.
Very interesting. So with the vaping, there's vaping where I can see logically, untrained and logically, if it's, something flavored, like, of course, there's going to be all kinds of preservatives and God knows what in there. But what if somebody comes to you and says, oh, no, I just vape cannabis oil.
Mm-hmm.
We can't ingest just, mist of oil. We choke, right? So there's got to be other stuff in it.
Yeah, there's got to be other stuff, these other chemicals. And again, I haven't gone through every little nook and cranny of every vaping device out there, but I can just tell you that one of the barrier systems that is very crucial to your health is your respiratory barrier system. So you're going to break down this respiratory barrier system, and once you start breaking down one barrier system, there's odds are you're going to break down the other barrier system. And the one barrier system that you don't want to be breaking down is your blood-brain barrier. Okay, because now you start breaking down your blood-brain barrier, you're going to allow for all these molecules, these larger molecules that were never allowed to cross the blood-brain barrier because it's very tight, and it only allows for very small particles can cross into and wreak havoc on the brain. Because when we look at our brain, we no longer look at it just purely in terms of neurons. We've known for many years that we have these immune cells in our brain. And over the last 10, 15 years, we've begun to understand that these immune cells have very specific functions that help maintain the integrity of the brain. However, they can become dysfunctional at times. And when they become dysfunctional, they can turn on this, what we call a brain inflammatory cascade, or a neurotoxic cascade. And literally your immune cells can actually eat your healthy neurons. And now you can start destroying your neurons. And you do that, it may not matter very much in your 20s, because we have billions and billions of neurons. But let's say you allow that cascade to happen for 10, 15 years, 20 years, and then, see what happens when you're in your 30s and your 40s, and you're going like, wow, I'm starting to develop some early onset of mild cognitive impairment. Or I'm that patient or that person that, has this neuroinflammatory cascade, and they get into a car wreck and I can suffer concussion or a TBI. And now I'm this patient that it's like, wow, I mean, that 5 mile an hour, 10 mile an hour, little rear end collision on 285, I mean, I can't. I found my keys in my refrigerator the other day, or I can't remember my, my password to my phone. Okay, and I've dealt with this. I mean, I deal with these type of patients in my practice all the time, where they come into the office and they go, "Okay, I just got into a small accident. I didn't get into this big accident, and why is my brain affecting me this way? Why am I developing gastritis in my gut? Why am I all of a sudden having hot flashes, or I can't sleep at night because my anxiety is way through the roof?" You are already inflamed. Okay, so that's really what it's about, is that if you're not working on your inflammatory zone and pulling that back, it's only going to get worse. And all the women that I work with in their 60s and 70s, they can go back and almost tell you in a very exact point of time. Pregnancy is an example that can flare up autoimmunity in a woman. Okay, especially a woman that's had a difficulty pregnancy in their second and third trimester. That's a sign that they may trip autoimmunity going forward. And so these are things that, I mean, it's real in real clinical practice. So.
Wow. Wow. Yeah. You know what? That is absolutely right. I can absolutely tell you it was after my second pregnancy that a lot of things started happening. And before then, you slept great, you woke up, you felt great, you had energy for the entire day. And I guess that would be the opposite of this. If I was to ask, okay, how do you know that you're running at optimal level?
Yeah, well, I mean, there's multiple ways you can do it, but let's just talk in the conventional way, where, like, if you're going to your primary care provider, what I would suggest patients realize is that when they go in for their wellness, let's say their wellness insurance type of one annual checkup, they're just going to run a Chem 14 and maybe a CBC with differential. So Chem 14 is going to look at, like, let's say your electrolytes, look at maybe some, a couple parts of your lipid panel. They're going to look at your liver enzymes. But more than that, you want them to start looking at something like this compound called homocysteine. Okay, it's a great marker to look at. It looks at whether or not homocysteine is elevating in your blood. It's a sign that you might not have what we call methyl donors in your body. Methyl donors are like your B6 and your B12 and your folic acid. And we can talk briefly about, a lot of people can have what they call single nucleotide polymorphisms, which are basically these little genetic SNPs. That's what they're called, SNPs, that may alter the way that biochemistry works. Okay, there's a certain population that can express that and may automatically cause some deficiencies in B vitamins. But B vitamins are also commonly become deficient because there's a variety of medications that actually can make B vitamins deficient. Or you start thinking about the amount of people that are actually eating the normal recommended dose, foods, 4 to 6, vegetables a day, if not more. And then we can go one step further and say, okay, it's the vegetables they're eating, they're not organic, so now they came from depleted soil, and now they don't have enough B vitamins to begin with. So start out measuring your homocysteine. Look at another particular marker that's great for looking at systemic inflammation is high sensitivity C-reactive protein. CRP is a great marker to look for an inflammatory storm. Then you can look at, a really big important relationship is your vitamin D. Looking at the level of your vitamin D is important. And then, from there, we can look at ferritin. It's a really awesome marker. Ferritin is a, stored iron, but when you're in an acute inflammatory storm, you can actually see that elevate. So if patients start seeing their ferritin levels rise, and they might be in an acute storm of inflammation. But C-reactive protein, your A1C, your hemoglobin A1C is another great marker to look at. That looks at whether or not you're glycating. What that means is that sugar that you have in your blood is bounding to protein or a fat, and it's basically becoming like crusted, almost like you would if you take a piece of toast and then you toast it, and that hardness of the toast is the glycation. And so that glycation gets accumulates in your vascular system. It's going to start causing vascular disease processes. So those are some simple things that people can do to become, really start, going that extra step, rather than just going and relying on their basic blood chemistry workup that they get from their primary care, to go that little extra step and ask them to add those on. I mean, if not, if their primary won't do it, then you can just find a really good functional medicine practitioner out there. And, many of us that are trained in this functional medicine, that becomes a standard of care of our normal labs. My normal labs are, probably about 75 lab markers that I'm going to look at, as opposed to just maybe 20 or 30 labs that, an insurance-based wellness checkup may look at.
Very interesting. So if someone's watching this and they're in Iowa and they would like to work with you, is that a possibility? How do you visit? You do telehealth?
Yeah, we do telehealth in the practice. Been doing it for a long time. So that's something, because I have a LabCorp account and I'm able to do labs in different states, and so get them out to the right, LabCorp, and then we can run those labs. I work with people internationally as well. And then, depending on the cases that I work with, I have basically two camps of patients that I work with. I work with, a variety of different neurological disorders. I work with, children that have really complex seizure disorders, or may have complex genetic disorders, or are non-speaking children with a variety of developmental history, to patients with traumatic brain injuries, to strokes, to chronic fatigue, fibromyalgia, obviously autoimmune disorders. Some of those patients will be seen in office. So some of them sometimes fly into Atlanta and then do an intensive with me, where they spend maybe 3 or 4 days with me in my office, and then I'm able to work with them remotely. And then some of the patients that I purely think might be more metabolic based, and we just need to run labs, and then from there develop a dietary lifestyle and a nutritional interventional plan. We can do that remotely. And then if I feel that patient needs to maybe have a neuro consult, I have colleagues all around the country that I will, send them to.
Oh, that's wonderful. Thank you so much. And you're taking new patients.
Yeah, I am. Yeah. I do, have a certain limitation amount that I take per month, but definitely, most of the people that come to me really have very complex histories, and so it makes it fun, it makes it active, and always trying to, learn more to address the complexity of these, because a lot of patients are having these multi-system problems. Okay, and the problem is that they may go to their one specialist, and they may go to another specialist, and they go to another specialist, but no one takes the time to actually step back and look at it and look at the whole case. They're just looking at it through their lens of their specialties. So if you're a cardiovascular specialist, you're just going to look through the cardiovascular system. If you're a neurologist, you're going to probably just look at it from a neurology-based mechanism. If you're an endocrinologist, you're going to look at it that way. But no one's going to step back and look at how are they all interrelated. And I think that's the beauty of functional medicine, or integrative functional medicine, in this country. The movement is getting bigger and bigger. There's very tremendous talented practitioners like myself that are out there doing this, and we're filling a big need in healthcare in this country. So.
It's a huge need. I can speak personally, and it's something that I step back for a moment. I've known you for 2 years, and, I was always going for tests or procedures or blood work or this, that, and the other. And I thought, let me get it all together and then bring it all into you. And I'm finally at that point, because I realized that when I filled my last prescription, and now it's a long list of them, because you have a neurologist, you have a rheumatologist, you have, this, that, the other, so many different doctors. I'm like, wow, I have a great team of doctors. But then it hit me, they're not talking to each other.
Yeah.
And that is tremendously troubling to me, because I look at the list of medications that I have and I'm like, should I be taking all of these? It's not good enough that the pharmacist knows the whole collection of what she's prescribing. So of course her system is going to pop up and say, oh, there's an interaction between these two. But then the functional health of trying to go in the right direction is such a mystery. So I'm really glad that you're there and you do what you do, because, especially I know that there's tons of patients like myself where we have multiple specialists. And you've got to have someone that, heads the team.
Sure. And well, when you look at healthcare in this country, I think most of us probably look at it and say, okay, we're probably very good with acute care. Okay. Very immediate care, but we're not in the majority of patients in this country are not in acute care anymore. They're in chronic states. We start looking at the incidence of diabetes in this country. You start looking at metabolic syndrome. You look at the rise of autoimmune disorders. All these things that they're not acute state things. It's not like, the beginning of COVID when somebody came down with a COVID and we were so worried that they were going to go to acute respiratory, failure. Okay. That's an acute moment. But I think our country medical system is set up for that, but we're not set up for what's happening, this tsunami that's happening in healthcare. I mean, we have the baby boom generation that I forget the number that's retiring per day, but it was just an astronomical amount of people that were retiring. I mean, my mother's in that level now, and you get above the average patient at 65 and older. I mean, at least in my clinic and in my colleague's clinic, I mean, they're on 8 to 10 medications. Okay, and so you start talking about the cross reactivity of these medications. You start understanding the micronutrient that they might be causing, the depletions that they're causing. And, for example, there's a lot of medications that might deplete vitamin K. Okay, we talked about statins. I mean, statins will eventually long-term produce neuropathies. Okay, and they will deplete your CoQ10. And CoQ10 is an extraordinarily important cofactor that's in the mitochondria that make ATP that run every living cell in the human body. Okay, so you start getting into these downstream mechanisms that are affected, and the problem is in this country is that we'll be good at being able to put a name to the disease process. Okay, we'll call it what it is, and then well, if it's elevated cholesterol, here comes the statin. And we never once thought about, hey, let's really look at lifestyle mechanisms. Okay, let's look at, is there underlying, viral issues that might be causing an inflammatory storm that might be changing the way, and we might be creating these elevated cholesterols or elevated LDL. And I think that in the American public is more than ever. I do think the pandemic really brought this to a different level. I know it was there. I know it was percolating before the pandemic because I've been in practice almost 18 years now. And so I know the movement of whether you want to call it alternative healthcare or whatever, the amount of visits had been increasing and continuing to increase and surpassing, typical, conventional medicine. But now more than ever, I think people are going and saying, okay, there's got to be a different way. At least my patients that are finding me are coming in and saying, hey, I've been to conventional practitioners. I'm working with vets that have gone to the VA and working with the VA, and they're like, we're done of just being ping ponged, and we're done about just being given another script and go fill this script. And so I think that's what's happening. I think the public is waking up to the idea that, do I really need to be on this 4th to 5th or 6th or 7th or 8th medication?
Right. Right. No, absolutely. Well, I want to thank you so much for your time. This has been very informative and you're fantastic. So, let's explore other topics. If you have time for me, just let me know.
Absolutely. Always.
You're on the show again.
All right. We appreciate it.
Your website is drscire.com. And Facebook, find you under Peter Scire. How else can we follow you?
Instagram right now is really, where a lot of people are finding me. TikTok is where they're finding me. And they just find me by Dr. Peter Scire on either one of those. Instagram probably has the most content. It's pretty easily available, and we're constantly every week really taking a new topic. Like this past week, we did mast cell activation syndrome, and that was a really hot topic that really started getting us a lot of viral, looks at and things. And so we try to pick a topic every week. So I think, we give, 4 or 5 posts per week on that particular topic. So.
Oh, that's wonderful. Well, thank you so much for everything that you do. And I really look forward to finally meeting you face to face. You are my next step. I'm there. So I look forward to it. And thank you so much for coming on and, having the time to talk to us tonight.
Absolutely. Thanks again, Elizabeth, for having me.
You're very welcome.
All righty.
Everybody, thank you so much for watching. As always, we are blessed. You are blessed. Mwah. I love you. I'll see you next time. Stay tuned. Oh, that was great, Peter.